The Delta variant is here in Wisconsin and spreading throughout our state. The Delta variant is a whole new game because it is highly contagious, much more contagious than the original strain of COVID-19. Let me give you an example. With the original strain of COVID-19, an infected person was likely to infect 2 other people, who were then likely to infect 2 additional people for a total of 6 cases from 1 infection. With the Delta variant, an infected person is likely to infect 5 people, who are likely to infect 25 people for a total of 30 cases from 1 infection. 6 compared to 30. You can easily see how this variant will spread like wildfire. As the weather changes and more people move indoors, the virus will spread even more rapidly. If you are unvaccinated and exposed, it's not a matter of if you'll get it, it's when. And we know that people who are unvaccinated are most at risk for getting very ill, hospitalized, and dying. With this surge, we're a few weeks behind our southern states. What we're seeing happen in Florida could happen here. Wisconsin has a similar vaccination rate to Florida, and COVID-19 cases are reaching an all-time high in Florida, and their healthcare systems are overwhelmed. We find ourselves in a situation that we hoped was in the past. We risk our hospital systems being overwhelmed again, just as they were last November. I don't want to focus on the doom and gloom, and I want to let you know that we have a way to get through the next couple of months by using the tools in our toolbox to help stop the spread of the Delta virus: masking and physical distancing. We all hoped that we were able to take off our masks for good once we were vaccinated. But because Delta is different, we know that we need to put our masks back on. It's clear why unvaccinated people need to wear masks to prevent infection, but why vaccinated people? Let me use an analogy to explain why. Masks are like a seatbelt on the airplane. You wear your seatbelt for takeoff, and when you hit your cruising altitude, you can take it off and move around the cabin. And if your plane hits a patch of rough air, the pilot asks you to get back to your seat and to put your seatbelt back on. So think about when vaccines first came out. We told everyone to wear masks, even if they were vaccinated, until we could study whether vaccinated people could spread the virus. In May, the evidence showed that vaccinated people were not spreading the virus. So we hit our cruising altitude and we took our masks off. Now, in August, we have encountered some turbulence as we learned that vaccinated people who are infected with the Delta variant can spread it to others. So we need to put our masks back on until we can stabilize disease spread. As the disease changes, we will put our masks on and take them off, just like we put our seatbelts on and take them off when conditions change in flight. This is also why we are urging all schools and school districts to adopt CDC and DHS recommendations to require students and staff to wear masks. Because our youngest students can't be vaccinated, it is the most important action for schools to take to provide a safe learning environment for our kids. And as I've said from the beginning, we need to achieve at least an 80% community vaccination rate. Vaccines are safe and effective, and they will protect you from serious illness, hospitalization, and death. The vaccines work. Please, if you haven't gotten your shot yet, go to vaccines.gov and find a vaccine provider near you. Getting vaccinated is an individual action that has a community impact, and well over 3 million of your fellow Wisconsin residents have taken that step to protect themselves and their community. We're moving in the right direction, but we are also not moving fast enough, and we need more Wisconsinites to choose to get vaccinated and protect themselves and our families and neighbors who are not yet eligible for the vaccine, such as our children. So please get vaccinated, wear your mask when you're indoors in public, in large gatherings, and most importantly at school. The COVID-19 vaccines are effective, and getting vaccinated, wearing masks, and following the science will make it possible to protect ourselves and our communities and to move Wisconsin forward.